If your loved one is in a hospital, nursing home, or care facility, and they have trouble moving on their own, there's one thing you can do today that could spare them months, even years, of suffering. Check their skin. Pressure ulcers, bed sores, whatever you call them, they are one of the most preventable medical complications in the world. And yet, every single year in America, they cost over $22 billion to treat. They contribute to more than 64,000 deaths. Here's why they happen. When skin sits against a hard surface, a mattress, a wheelchair seat, for too long, the pressure cuts off blood flow to that spot. Press your own finger into your skin right now. See how it turns white, then comes back to color once you let go? That's blood flow returning. That's the body working the way it's supposed to. But when pressure isn't relieved, when that blood flow doesn't come back, the tissue underneath starts to die. What begins as simple redness can progress, within hours or days, into a deep, open wound. This isn't rare. It isn't something that only happens in bad hospitals. It happens quietly, in good facilities, to good people, simply because nobody pressed release in time. Certain people are especially at risk, and it's worth understanding why. Paraplegics and quadriplegics often can't feel the warning pain that would normally make someone shift position. So, damage builds silently. People who are malnourished or very thin have less natural padding between bone and skin, so pressure concentrates in a smaller area. Anyone too weak to reposition themselves, whether from illness, surgery, or simple frailty, depends entirely on someone else to notice and act. People living with dementia may not be able to communicate pain at all, even when they feel it. And trauma patients, especially those in casts or restrictive positioning, often can't move the way their body needs to. Nobody presses release for them. That's your job, if you're the one who loves them. It can start in as little as 5 minutes. I spent 40 years as a home health registered nurse. Nearly 80% of the wound care I performed in that time was for pressure ulcers. Not rare cases, not unusual complications. The single most common thing I treated, and one of the most preventable. So what can you actually do? Check the skin yourself. The patient can't always do it, but you can. Look at the heels, the ankles, the buttocks, the back of the head, the elbows, the spine, the shoulders. Any of the spots where bone sits close to skin. And know this, it is your right to ask. No facility can refuse you a skin check. If they do, that's a red flag, and it's time to get an attorney. Take pictures the moment your loved one is admitted. Why? Because if a pressure sore shows up later, some facilities will claim it was already there. Documentation from day one protects your loved one and protects the truth. The fix, when it's caught early, is almost embarrassingly simple. Turn and reposition the patient regularly. A $10 pillow under a vulnerable pressure point can prevent damage that would otherwise take weeks or years to heal. 5 minutes to form, 1 minute to prevent, $10 for a pillow. Check their skin. It might be the most important thing you do for them today. And if you're wondering what the very first warning sign actually looks like, that's exactly what we're covering next.